How can infertility be cured? There are some treatments available. These treatments are based on proper diagnosis. You have to find out what is the exact cause for infertility, and then the treatment has to be decided. Counseling for the couple. They must be mentally and physically prepared for undergoing the treatment. And identification of the suitable treatment. Because depending on the cause, the treatment varies. It may involve just suggesting some medicines, prescribing some medicines and following up. So it may involve just chemotherapy, or it may involve sometimes a surgery. If there is a defect in any part of the reproductive system, and if that defect can be surgically set right, then surgery can be done. Suppose the treatment fails. If the treatment fails, there is an alternative, and that alternative is that the couple can go for what is known as assisted conception. Several techniques are available due to advances in the field of medical science. Several techniques are available for such couple by which they can have a child. These techniques are collectively known as assisted conception or artificial reproductive techniques. Artificial reproductive techniques, commonly abbreviated as ART. Before going for assisted conception, again, it is necessary that there should be a proper diagnosis of the cause for infertility, because different types of assisted conception measures are available for different regions of the reproductive system. So proper diagnosis is important. The couple should be informed about the technique that is suitable for them. they may be suggested the possibilities, options, selecting the suitable treatment, selecting the suitable technique. That is another important aspect. And preparing the mindset of the couple. Preparing the mindset of the couple to undergo this assisted conception, and very important, the couple must be provided information about success rate, because in these techniques the success rate is comparatively very less. If there is a failure, what are the possible causes of failure, or there may be sometimes the chances of miscarriage. So all these possibilities are there. Therefore the couple must be properly informed about all these aspects. Their consent must be taken, their mindset must be prepared. These techniques, assisted conception techniques, primarily involve manipulation of the gametes. Manipulation of the gametes. Primarily, the idea here is to see that the gametes undergo fusion under artificial conditions. One of the very familiar technique, one of the earliest technique is called in vitro fertilization. In vitro fertilization. Commonly followed techniques is artificial insemination. Artificial insemination. In this technique, the sperm sample is collected from male. Sperm sample is collected from male, and this sperm sample is introduced into the fallopian tube. By using some surgical methods, the sperm sample collected from the male is introduced into the fallopian tube. This is particularly done in such cases where the sperms are unable to reach the fallopian tube under normal circumstances and bring about fertilization. So directly the sperm sample is placed into the fallopian tube. This is of two types. One is artificial insemination homologous. This is done in which, in this technique, sperm sample is collected from the male partner. So imagine a situation, there is some problem in the female reproductive tract, sperms are unable to reach the fallopian tube, therefore sperm samples are directly to be introduced. Suppose the male partner among the couple also has a problem of sperm quality. So this technique is followed in such cases where the female has a problem in the reproductive tract, sperms are unable to reach the fallopian tube, therefore the sperm sample has to be introduced directly into the fallopian tube. This is of two types. One is artificial insemination, homologous. In this technique, the sperm sample is collected from the male partner. So among the couple, let us assume that only the female has a problem of infertility, the male partner has a normal situation, his sperm quality is good, therefore his sperm sample can be introduced directly into the fallopian tube. The other possibility is, suppose there is a problem in the male also, the sperm quality of the male partner is not satisfactory, semen volume may be less, motile sperms may be less, number of spermatozoa may be less. In such situations, another technique is followed. This is called donor insemination. Here, sperm sample is collected from a healthy donor. Sperm sample is collected from a healthy donor, and this sperm sample is introduced into the fallopian tube. For obvious reasons, the identity of the donor is not revealed. So from an unknown donor, then it is called donor insemination. Another technique that is available is called in vitro fertilization. In vitro fertilization, very commonly known as the IVF technique. IVF technique, and more commonly known as the test tube baby technique. In vitro fertilization, sperm sample from the male partner and ovum collected from female partner separately are allowed to undergo fertilization outside the body. Outside the body. That is what we mean by saying in vitro. In vitro means outside the body. So sperm sample is collected from the male partner, ovum is collected from the female partner. They are placed in a special container under laboratory conditions, simulated laboratory conditions almost similar to what is inside the female reproductive system, and then the sperm is allowed to fertilize the ovum. So fertilization takes place outside the body. Therefore it is called in vitro fertilization. This in vitro fertilization results in the formation of a zygote, a diploid zygote. Once the zygote is formed, there are two options available.